Good.
Okay.
Okay, so continuation of the pelvis, the Thomas test. Thomas test, what you want to do is that you want to ask that patient to bring this knee up to the chest and then hold it right up here and then slowly ask the patient to come down on the table. When you do this, my right hand is on the back of his lower back. And what I'm doing is that I'm going to bring this knee up to make sure the lower back is flat. And then pull this out and then observing the hip flexors and also checking for the knee flexors. If this should be, so this will be a positive both on the hip flexors and knee, like a rectus femoris. So iliopsoas and rectus femoris is tight. If the iliopsoas is not tight, then it should be down here. So that would be a normal, but then this will be tension is up pretty tight. The rectus femoris, so this is also testing for the rectus femoris contracture. If the rectus femoris is not tight, if it's negative, it should be down here. But since it's the rectus femoris tight, it's coming up. So by doing the Thomas test, usually Thomas test is checking for the iliopsoas right here, hip flexors. But then the part of the Thomas test also can tell rectus femoris contracture right here. Okay, come up. The next test that we're going to do the Gaenslen test. In order to do the Gaenslen test is actually checking for the SI joints and the anterior SI joint ligament. So that's actually talking about the anterior SI joint ligament right here. So in order to do that, we need to bring this side of the SI joint back in a little bit in posterior. So we're going to have the patient to actually have this side of the leg off the table and then kind of sit kind of diagonally a little bit. So you have to have kind of patient more diagonally and then bring this leg up. So we're checking on the right side and then go down on the table. And then again, my hand is going to be on the back, just kind of make it flat and then slide my hand out and then checking. When you check, this is again, it's pretty tight right here. Both of them, well, it's a little bit better on the SI joint itself. But in here, Gaenslen test, you want to actually push it down a little bit and you stretch the anterior SI joint ligament to kind of feel, and the patient will usually notice the pain. Next test is going to be Ober Test. Let's have the patient lay on the side, right side down. And when you do the Ober Test, you want to straighten the leg, and then go ahead and scoot up. And then there's a couple different ways that you can do the Ober Test. You can first, I usually like to do, just kind of bringing it up in the abduction, slowly bring it down, and it goes a little bit more on the posterior aspect and making sure that they can go kind of stretch the tensor fascial lateral muscles and also IT band. Okay. If you suspect and you want to try to kind of see more, then you can ask the patient to come closer to me and have the leg be able to go off the table. Then this way you can do a little bit more AD deduction and see how much of the tension right here. If somebody have a really tight IT band, I'm going to bring this pants up to here, but a lot of times if it's really tight IT band, you can see the line and you actually be able to observe the IT band itself. When it's like that, you can also really gently palpate and you'll find those little tiny nodules. And I find a few of them right here. And that's like a typical sign of tight IT band. Other way that you can do is that actually bend the knee a little bit. And then the first test that I usually like, because it's all attachment of the IT band going to the fibular head aspect, that you're stretching all IT band. But here, if you want to check the midsection of the IT band, kind of bend the knee and then slowly AD deduct and see if you start seeing the contraction of the IT band fascia itself, or it's difficult to kind of bring it down. Then your indication is more tension right on the IT band right here. But I prefer on the first one that you can do, just kind of stretch it and see whole IT band from the pelvis to down to the leg. Okay. And then next test is, let's see, Piriformis. The Piriformis test, a couple of ways that you can do. Go ahead and scoot forward. This is almost like a position to do manipulation. What you can do is that you can actually bring a little bit more. Bring the affected side of the piriformis, and kind of stretch it a little bit, and a little bit more. And then you can actually kind of stretch the piriformis itself and see. The piriformis is attachment in the anterior surface of the sacrum to the greater trochanter. So also like looking at the greater trochanter and the sacrum itself and kind of stretching it, that would be a good way to find and provoke the sciatic pain pattern if this piriformis is the problem. Another way is that go ahead and lay on your back. You can also kind of stretch the piriformis by doing this way. That'll be fine. Or you also can do Bonnet Test, which is, we discussed in the lower back section, that you can do the straight leg raise test. Right here, there's a pain. If there's a pain, decreasing a few degrees or so. And then what you can do is that to first alleviate the pain a little bit, and then internally rotate it and 80 deduct. You're stretching the piriformis, and it usually goes, the pain goes up. So that will be a Bonnet test. I think that's it.
Lagurre? No.
Oh yeah, Lagurre test. Sorry, I think I forgot. Lagurre test is for the hip, and that's the FABER in the air. So this will be a FABER test right here, and then Lagurre test will be up and an external rotation of the hip joint itself. So you can just do this and check for how much of the pain. When I do the Lagurre test, I also do internal rotation too. A lot of times when the patient have a hip joint problem, internal rotation is a little bit difficult to do. So, but you can also check the external rotation, internal rotation, and see there's a pain. If somebody have a fracture though, on the hip joint, external rotation is going to be really hard to do. So sometimes you can just ask the patient to externally rotate the hip joint just on the supine, and if they cannot do it, kind of suspect, do the anvil test, make sure to do the tuning fork, make sure to rule out the fracture. If you still suspect it, send it for the x-ray.